talk came from, where we talk about the parts of when a behavior occurs. So an antecedent, it is what is occurring right before a behavior occurs. Behavior is what that child does, what the adult does, what the person engages in is the behavior, and the consequence is what occurs immediately following that behavior. So when we look at behaviors, this sort of focuses on those maladaptive or problem behaviors, but even when we're looking at appropriate behaviors, we always want to consider kind of what's setting the event for that behavior to occur and what's happening that's going to afterwards. So an antecedent is essentially something in the environment, a stimulus, kind of things that are occurring in the environment before a problem behavior occurs. It could be a direction. It could be told no. We see a lot of those, right? Having a preferred item removed or no longer working. The iPad battery dies, the internet goes out. Mommy takes the iPad away. The cookies are all gone. Presence of an object, so something, seeing like a cookie on the counter, seeing the iPad that's no one's using right now. Being presented with non-preferred items, peas, vegetables, a math worksheet, all those things. Or they can be internal, so things like hunger or a headache, those are all internal antecedents that could also evoke problem behavior. So these, like I said, are events that trigger or occasion that problem behavior. So when you're thinking about a problem behavior that you're trying to manage, you always want to know kind of what tends to occur before that problem behavior is emitted by your child. So what's happening in the environment, what's being said to them, what's happening around them that could potentially be triggering that behavior. Behavior is those things that are observable. It's either sitting down, asking for something, throwing something, hitting their head against the wall, hitting you, things like that, dropping to the floor. All of those are behaviors that we're looking at. So we want to be able to identify what we're trying to address and really be able to define that in a way that is observable and that we can work to specifically identify so we can reduce it. And then the consequence, that's what's happening afterwards. So there's a change in the environment after the behavior occurs. Most of the time, these are what we call socially mediated. So something that another person will either give or take away. So giving a cookie or giving the iPad, being told stop that, being told good job. Those are things that come from another person. Or parents removing the item, or if you throw the peas, they're gone unless mom brings them back, but at least they're gone for a little bit. Attention is removed. Maybe mom walks away or the sibling leaves you alone after you hit them and things like that. So all those are consequences, things that are happening in the environment after the behavior. Sometimes something like your headache goes away or you're not feeling pain anymore. Those are things that aren't in the environment, but maybe not observable, but those kind of are related to what we call automatically maintained behaviors, which we'll talk about in a second. A consequence is important because those are what's going to either increase or decrease. So when we think about them, and we'll talk more about consequences, we talk about reinforcers and punishers in a behavioral sense of what's going to increase the behavior, the likelihood of that behavior occurring or decreasing it. So those are important to think about. I always do this. I start talking about what's on the next slide, even though it's right there. So reinforcers and punishers are consequences. Reinforcers are going to increase the probability that a behavior will occur. So if I say I want a cookie and I get a cookie, then my verbal language of I want to get a cookie is more likely to occur again. If I say I'm presented with a math worksheet and I hit my head and the teacher takes the math worksheet away, I'm more likely to hit my head in the presence of a worksheet the next time. So that behavior was reinforced by the removal of the worksheet. A punisher is going to decrease the probability that a behavior will occur. So if I hit my head when I'm presented with a worksheet and the teacher does not take it away, then I'm less likely to engage in hitting my head. So that non-removal or the maintenance of that presentation of the worksheet is going to actually maintain that and will decrease that head hitting. We talk about things being a positive or a negative in the sense of like the mathematical sense of positive, something is being added to the environment. So if I say I want a cookie and I get a cookie, that's positive reinforcement, something is being added to it. If I hit my head and something in the worksheet is taken away, that's negative reinforcement, something is being removed. Not in the sense of like the tone or anything about that. It's really just an additive or a subtractive property there. So I think that's something that is tricky. So if we're talking to a behavior analyst and they talk about negative reinforcement, that's not punishment, it just means something's being removed that's aversive or not pleasant. But we could go into a whole discussion just about reinforcers and punishers, but just thinking about what do we want to do and what are we going to add to the environment as a consequence to either increase or decrease the likelihood of a problem behavior occurring. And identifying those is very important so that we can figure out the function. The function of a behavior is why it's occurring. So why is my child or a young adult or an adult engaging in aggression? Why are they engaging in crying? Why are they engaging in elopement? We want to know what's happening, what consequences are occurring that are maintaining that behavior in the environment so that we can modify those so that we can identify an effective intervention that's going to reduce the probability of those continuing to occur. We also want to look at what's happening in the environment beforehand. We'll talk a lot about antecedent management and figuring out what can we do to prevent those behaviors from happening or reducing the likelihood in a way that's sustainable and is going to, maintain and be appropriate in the environment. But we want to know why a behavior is occurring. So as behavior analysts, we generally will divide behaviors in looking at them as 4 different functions: escape, attention, tangible, and then sensory or automatic. So we talk about potentially using the acronym EATS. So escape, attention, tangible, and sensory or automatic. So escape maintained behaviors. This is one of our socially mediated behaviors. Something that is removed that is non-preferred or an aversive event or activity. So if I, rip up my paper and I don't have to do my math worksheet, I'm getting out of that work or task. I can avoid a social interaction by either, engaging in tantrum and then mom doesn't bring me to the birthday party, or I might say, oh, I have a headache and now I don't have to go to school like my kids did yesterday. Or I might just leave an unpleasant location. So if I'm at the doctor and I run out of the office, then that is escape behavior. I'm leaving it because I do not want to get that flu shot. So those are all escape maintained behaviors where you see that they're getting out of something or you're escaping from something. Attention is that social interaction, some sort of attention from another person. And these can be from peers or adults. It could be a physical interaction, it could be praise, or it could be admonishment. So a lot of times we do see people that could be their problem behaviors is maintained by some sort of attention. It doesn't matter if we would perceive it as positive or negative. So me saying, stop that, don't do that, that you're hurting yourself, don't do that, you're hurting me, that's annoying, that is attention. And so the child or the adult may not necessarily care what you're saying. It's just that they are getting attention from you. You are paying attention to them, and it's undivided. You are definitely aware of them in that moment. And you're not paying attention to someone else in that case as well. So even though you may be adding something, and so we would call it positive reinforcement in the form of attention, it could still be, words that one might think could be punishing, but in this case, they're not. Access to tangibles is another function of behavior. So getting access to an iPod, an edible, an activity. We don't really get a lot of activities nowadays because we're all stuck at home, but access to those things, that's a tangible function. And then finally, we talk about sensory and automatic behaviors. And this, again, could probably be its own presentation as far as looking at those automatically reinforced behaviors, where the behavior itself is reinforcing either adding or removing a sensory stimuli. So hand flapping, head banging can potentially be automatically maintained. Scratching an itch is something that we all do. I scratch an itch, the itch goes away. So that is, it was automatic negative. Taking an Advil to get rid of a headache, the headache goes away. So a lot of those sensory, the automatic behaviors, we do see something like scripting or pacing, potentially, again, like I said, I'm a behavior analyst, not a psychologist, but sometimes we see a lot of what we might say is like anxiety type behaviors or rigid, repetitive, OCD type behaviors. A lot of those are automatically maintained where there's something intrinsically reinforcing about those behaviors, or potentially there might be something about like a pain attenuation or sort of like anxiety attenuation, where if I repeat the same thing, then I sort of may feel calmer, or being able to like clean up my desk in a way that maybe is perceived as like OCD, but I'm relieving some sort of internal tension that behavior is reinforcing. And those tend to be the hardest to sort of intervene on, because I really can't control those things in the way I can control access to an iPad or a cookie. But there's a whole lot of research on that, and that's something, again, it's a whole other presentation in and of itself. So, super quick primer on behaviors. Melissa, are there any questions before I go on?
Yes, there's one about data collection.
Okay.
And what the standard is for that every day, a few times a week.
Great, that's a great question. That's fantastic. It really depends on a lot of different things. When I have my parents collect data, sort of depends on where we're at in our ABA journey, and also what level of frequency and intensity the problem behaviors are occurring. So sometimes, in session, for example, if I'm running a session at a school or at home, I might have my therapist take, frequency data, every aggression, or every time a child hits their head. But if it's a parent that's also managing, online learning and in home, and they're doing other things, I might do more of like every hour. Did aggression occur between 3 and 4? Did it occur between 4 and 5? So what we would call a partial interval. So like a yes, no. And I don't care if it happened 50 times or just once. I just, and that can give me a good estimate of how often it's occurring. And then also when it's occurring. Is it happen usually like right before dinner when I'm starting to get hangry, or, right in the morning when because my 4-year-old is not a good waker-upper. If he's woken up unexpectedly, he is an angry little man. So, we can look at patterns too in those cases. So we could do like a yes, no, or an absence, presence of a behavior, or a frequency, and things like, or if it's, what we would maybe kind of call a tantrum, where maybe it's a combination of crying, whining, flopping, aggression, where you maybe just take a duration of how long that occurs, because sometimes we want to work on decreasing how long those problem behaviors are occurring. So that's a great question. And I think, I tend to start with a lot of parents with just like, did it happen in the morning today? Did it happen in the afternoon? And getting it a little bit more fine-tuned. The more specific data can be more helpful, but honestly, accurate data is better than inaccurate specific data. So I'd rather know, like, did it happen at all today consistently versus like, I got frequency 3 times a week. So I would say, honestly, I hope that helps. It's a little a roundabout, but honestly, accurate data is more helpful than specific inaccurate data. But then I think, because that can really help us guide what we're looking for when, we might be coming in to help, when you have different strategies in place, which is actually what we're going to talk about now. So knowing if a behavior tends to occur, Mondays, for example, a lot of kids, transitioning back, Monday mornings are rough. And also virtual learning now Thursday mornings, because we've all been off half day or a full day off on Wednesday. So like Mondays or Thursdays are the new Mondays. Or days after holidays, longer breaks tend to be more difficult. I've seen data too, knowing things like if a child lives in 2 houses, with 2 sets of shared custody type agreement. The day that the child switches houses can be more difficult because it's a change in transition, or if there's any change in a schedule like that. Grandma brought them to school today, things like that. So all those things are super helpful to know, and being able to share that with any team that you're working with and being able to identify it. And then using antecedent management strategies to really like prepare your child and to prepare your environment to minimize those disruptions and really minimize the probability that the behaviors are going to occur. Not necessarily not making any transitions, but if we can prepare the child, and I use child loosely, I apologize. I know you said a lot of people are 15 plus, but I feel child is better than client. So, so the person that we're working with, if we we can prepare them using some different strategies to minimize the probability that that behavior is going to occur. And also helping them to learn how to deal with those different things and tolerate those changes and all of that stuff. So antecedent management are interventions that we put in place to reduce the probability that those maladaptive or challenging behaviors are going to occur. We're altering that environment before that behavior occurs to reduce the likelihood. And these are things that you can put in place to really support throughout as long as needed. When I work with families, I really try and identify strategies that are going to be not disruptive to the home, because I'm not going to tell you to do like a huge visual schedule with every single 5-minute interval for the whole 24 hours of your day, because that would probably work for like 2 days and then it wouldn't be maintainable or sustainable. That's not the point. I don't want to set up huge, crazy token systems where every minute of every screen time is monitored and earned, because again, that's not sustainable. Maybe before I was a parent, I might have been like, this will be great. Now I'm just like, okay, what's the bare minimum I can do as a mom to make sure everyone's safe and is doing what they need to be doing. So definitely figuring out what's going to be sustainable. And maybe it's just something we put in place briefly, or during school time, and your plan on the weekends is different. So I think definitely those things, important things to think about. A lot of things we'll think about are like changing the environment or setting up a room so that the problem behavior is maybe less likely to occur. I was with a client this morning, and so where we have him sort of stationed for virtual learning is sort of in a corner. Again, he's not in like the corner with like the pointy hat on, but like I use my environment to sort of manipulate it to minimize the chance that he's going to get up and run away. Again, also then prompting him to ask for a break or to go, and really honoring those. But I'm not going to have him sitting next to the door and I'm across the room, because that's really just not setting anyone up for success. And I want to be able to teach those behaviors of having him ask for a break or to go in a way that's going to really help him learn functional replacement behaviors instead of eloping or engaging in climbing on the furniture or things like that. A lot of times, working in schools, kids are, using computers for breaks, or, if you've got multiple kids doing virtual learning, and maybe you've got a second grader, but the pre-K looks much more interesting. And so you want to think about how are you setting up that environment so that the second grader can really focus and concentrate on their learning versus their younger siblings' fun little circle time songs. So you don't have them sitting next to each other, maybe across the room. Someone wears headphones, things like that. Using schedules and routines. So like I said, I think a visual schedule is great, having everything written out. But again, also, especially now, nothing is predictable. So we try and be as predictable as possible, following those routines. But I'm not going to say like put everything on a whiteboard down to the like 15-minute interval, because that's just, then you're going to feel tied to that and stuck to it. And probably end up digging yourself in a bigger hole. But, following those predictable routines, bedtime is, pajamas, brush your teeth, read a book, lights out. For dinner time, you wash your hands, you put the iPad away, you don't have that, you come wash your hands, you come sit, you eat, and then you wait till everyone's done, and then you put your dishes in the sink, and then you can go play on your iPad. A lot of times, visual schedules or written schedules for the day. Again, like, and depending again on your level, what you need, if you need pictures, there are so many iPhone and Android apps now that have like visual schedules built in that you don't have to even have pictures anymore. If your child has an iPad themselves, they might even have visual schedules. You could download an app for cheap or free that have a lot of those in there where they can move things over from, you know, to do and done or check mark, put it in an all done thing. So I still love a good laminated visual schedule, but a lot of times you don't necessarily have to do that since we all are on our technology so much now. Or you can have like specific tasks, you know, getting dressed. So you may have a schedule like on the dresser of underwear, shorts, you know, shirt, socks, you know, brush hair. And maybe that's their like get dressed schedule. I like visuals a lot because they're tangible. They're as opposed to like words that are like in one ear, not the other. And then you can reference them and they are built-in prompts. We all use schedules. My desk is covered in sticky notes. I would not survive. I would not even be here if this hadn't been on my calendar. Like I wouldn't, you know, so we all use those and those are fairly, you know, normal and accepted things. And so figuring out how can we make those work for any kid. I think they can too, again, this is a little non-behavioral, but they do help reduce anxiety of knowing like what's coming up, how long do I have to do, like when am I done, knowing if today's a half day or if I have to do asynchronous learning, how many lessons or how long do I have to do Dreambox and LexiaCore or iReady or all those different things, and what's the expectation, and having that written out can be really helpful, or written visually somehow represented. Similarly, having those clear contingencies and expectations. So reviewing them throughout the day proactively. First, you need, this was me this morning, before you can play Minecraft, you have to do one lesson each of iReady, reading and math. You know, so like, again, that's the expectation. This is what you need to do. You can't play Minecraft until you do your iReady. And having those either written down with visuals, timers, schedules, things like that. Again, doing what you need to, but again, not overdoing so much that it's like a written schedule, a visual schedule, a timer, because again, we also want to be sustainable and something that could be maintained across multiple environments. Some examples of things as far as presenting things as contingencies in clear language. This is a really helpful one for any child that you may talk to. So don't say, can you pick up the pencil when you have a second? Because the kid's going to be like, no. Instead, just pick up the pencil. Or so being very direct, not as a question, but as a, this is what you need to do. Giving the child the direction of what to do. So use your words, use your inside voice, say please, not don't scream, don't whine, things like that. So being explicit in your expectation of what they should be doing. Because if you say don't scream and whine, then that leaves open the opportunity for, well, I could still hit or I could grab. But if it's use your inside voice, use your words, that's exactly what you're expecting them to do. First on language. First, clean your room, then snack. First, do iReady, then you can take a break. Written prompts. Some kids, if they are can read, and you know, if you for things like you have a kid maybe that's unmuting themselves and interrupting during virtual learning. If you have like a written prompt or even the icon for excuse me, where you could teach them, and you can just they have that like on their Chromebook, they can see it. It would maybe you can teach them and it would help to prompt them to say like, oh, I can say excuse me before I just blurt out and interrupt the teacher. And so things like that. Again, written prompts, visual prompts, all those things, similarly, not exactly related to problem behavior, but, you know, having, if you're working on toileting or having a kid learn to ask for the bathroom, having bathroom icons, you know, out on the bathroom door or around on their workspace will help me remind them like, oh, I can ask for the bathroom, things like that. Or break card, having a thing where all they have to do is touch the picture of the break so that then they can, you know, ask for that break instead of engaging in problem behavior. That's really going to help them be able to ask for that and get their needs met. Other things, using either a behavioral contract, depending on, again, like your age and sort of like a level of understanding. You know, I did this for a couple of kids where I was like, okay, you know, they had to do something they didn't want to do. Okay, this is the expectation. You're going to do X, Y, and Z. Mom and dad are going to do A, B, and C. Let's sign it. Let's agree to it. Star charts, token boards, little like, you know, 5 stars, you get a break, things like that. It helps you track the amount of work that has been done, how much more is left, when the reinforcer is going to be available. Even things like, again, depending on your level of your learner or your child, you can, you know, work on you know, kind of increasing those expectations slowly of like, okay, you know, you did great today, but I had to help you, remind you to pay attention 6 times. Tomorrow we're going to let's aim for 5 times, and kind of how long, you know, how many prompts did they need, or how many did they follow all their rules and things like that. Just different ways of setting expectations, and where you're sort of increasing the expectations for your child slowly. Another antecedent management technique is just that dense schedule of reinforcement. So really just like catching your kids being good, really noticing that, lots of extra praise. That's tricky because I do have some kids I work with where like any sort of, especially like happy, like super party type phrase is like actually is not preferred. And the kid sometimes engages in problem behaviors when you're like, yay, and they get really upset. Behavior specific praise. So not just like good job, but I really like how you picked up your room and put all your toys away, or nice job doing all that by yourself, or, you know, thank you for sharing with your brother. Good job going potty. You know, we want to provide praise at least 2 or 3 times more often than you're providing that any sort of like redirection or constructive feedback. You know, whenever they do it, you ask, thank you for putting, you know, your blanket away. Nice job getting dressed. Just really catching them being good, and really like, especially if any of their problem behaviors are maintained by attention, we really want to think about like, how can I just give them so much attention when they're being good that they don't really have to engage in those problem behaviors, because they're really getting the attention that they want just by being good. Non-contingent reinforcement. So getting either access to the reinforcer before it occurs. So kind of like absent of like even asking for a break, if hitting is maintained by escape from demands, just like every 30 seconds or every 5 minutes, you get a break. Even if, you know, you were doing great, you were on task, you get a break. You're just, good job, go take a break. If you're being compliant, you get extra breaks. Sometimes maybe they're not being appropriate and they still get a break because it's non-contingent, but really like planning for things like breaks throughout the day, based on if any sort of your problem behaviors are maintained by escape. Again, sort of similarly, if we talked about attention on the previous slide, if anything is maintained by attention, just any time that they're, you know, being appropriate or absent of screaming, then you're just giving them praise you're giving them attention. And if they like physical attention, you're giving them tickles and squeezes and hugs. If they like praise, if they like to be told jokes, whatever they like, you're doing it when they're not engaging in that problem. This is especially helpful, I think, when you think about like all the stuff that our kids are supposed to do, or, you know, planning, breaking tasks up, altering expectations. A lot of breaks, especially if we're seeing, you know, escape from tasks, lowering the effort. Sometimes if, you know, a child is expected to do a lot of writing or typing, just write for them, type for them, use the text to talk on Google. You know, breaking things up with meaningful breaks between. So if I'm, you know, you're doing like iReady and Lexia Core and still have to do something else, like breaking that up and having it throughout the day versus like trying to get that all done at once. Another way I think this is really helpful and can be done with any kid. So if like I'm playing on an iPad and then it's like time to do something super non-preferred, like, you know, take a bath, and maybe your kid doesn't like to take a bath. So, you know, rather than going right from the iPad to like a super non-preferred thing, maybe it's iPad's all done. Let's read a book together. Or let's do a puzzle. Then we're going to go to that super non-preferred thing of a bath or brushing your teeth or something like that. So you're not going straight from like 100 to 0. You're kind of going 100 to 50 to 0. And that can be really helpful as far as kind of titrating down instead of just like the shock of the super non-preferred after I was in like super iPad heaven. Before I go on, are there any questions about antecedents, Melissa?
I'm not seeing any folks. Please feel free to put any questions into the chat that you have.
Okay.
Anything else that would be that you might mention that might be, I would assume a lot of folks with the virtual learning, some ideas about that as examples.
Yeah, I definitely have found that, and I think too, a lot of that is support. So, you know, and that's kind of where, like, again, the level and kind of what classroom your child is in, as far as just supporting your child, I think has been really difficult. And you know, I feel for the teachers right now. My thoughts on virtual learning, and we've got, you know, some of our therapists working, we've been working with kids during some virtual learning to kind of support that. And I've been trying to, throughout this pandemic, trying to find those small silver linings of like, what are we going to take away from this? What's going to be good? And for some kids, and again, not every kid, and I know there's many kids that it's just been, you know, the parent or whomever, grandma, some sort of caregiver is having to sit with them, and there's minimal like interesting, you know, it's been hard to like really tailor to that child. I'm not trying to be a Debbie Downer here, but whatever we can do to really start to increase our kids' independence, because we are here with them, and, you know, and kind of coming up with ways to, you know, track, you know, because someone asked about data. So if I'm like, how many times or how long can they stay on task? You know, and setting those small goals of like, okay, their baseline time of is 2 minutes before they start to engage in problem behavior. So let's at 2 minutes have them ask for a break instead of waiting for them to engage in problem behavior. So then you're teaching them to ask for a break. So a lot of the antecedent management too then comes in with teaching communication. So having a break card out, and honestly, you can, if you don't have picture exchange cards, or you don't, you know, even if your kid can't necessarily read, if you write break and it's like a picture, or you have like print something from YouTube, or not YouTube, from Google Images of like a person taking a break with an iPad or something, or just like sitting back with their feet up. And you pair that with like, look, you get a break, and you have them touch the card to ask for a break or say the word break. They get a 2 minute or a 30-second break. You know, message the teacher and say, my kid's taking a break. We'll be right back. But doing that on a schedule that meets their needs, because right now this is hard. And a lot of the stuff isn't necessarily interesting. I had to watch a video about coronavirus and wearing a mask, and the kids, it just meant nothing to them. So teaching them like how can they for a break, or asking for those things, and really honoring them, and then starting to build up their toleration. So like right now, your child can sit for 2 minutes during virtual learning, and then you prompt them to ask for a break, even if they're being appropriate. Maybe in the next couple of days, you work up to 2.5 minutes, and then 3 minutes. And then if they ask for a break after a minute, I would honor it. You got to be mindful of them asking for a break over and over again, which means they understand what they're doing. And so then you add in contingencies of like, okay, 1 more minute, and some, you know, delay training and things like that. But really, communication is really the best way to target all of these problem behaviors. Is that kids are engaging in problem behaviors in order to communicate, because they don't have another way of communicating either their want for attention or their desire for something, or they may have those skills, but those problem behaviors are more efficient and effective and quicker that's probably more efficient. But like, if I say I want a cookie, or maybe in this case, I'm done with virtual learning, I want a break. And you're like, oh, in a minute. And then a minute turns into 5 minutes, and just keep going. You're almost done. But if I start hitting my head, or I like shut the computer off, that's very effective. And I definitely get a break for at least a couple of minutes. And I got exactly what I wanted when, and it was quicker than me waiting or even saying the words of I want a break. So really thinking about like, how do you teach that communication and honor it, and work with the teachers that they're working with to honor that communication of this, and I think a lot of it is, this is hard, or, and I think a lot of the kids that are working kind of in the, maybe would be in some pullouts and things like that. And so they're with the general ed without their aid, because the aid's on a screen. And so you're sort of modifying a lot, and they're sitting through 3-digit addition when really in their pullouts, they're doing 1-digit addition. And so they're struggling. And so really is that, how can we work with them to help them, ask for a break or ask for something else to do, because this is hard. And being able to say this is hard and I don't know what I'm doing is a very difficult skill. So I think really working with your kids, with your teachers, to increase that communication, because without that communication, their default is going to be to engage in those problem behaviors. So
thanks, Kat. We've got a couple more questions. Do you want another
Great.
question? Or do you want to?
Questions are, go ahead.
All right. My 4-year-old behavior has increased, and we see the neurodevelopmental pediatrician in January. We really don't want to medicate him, but he's getting very aggressive in behavior.
For that, I would say something to the effect of, and again, I don't know specifically if they're getting other services. Again, behavioral and ABA, BCBA could really be effective in that. And I think sometimes people think, oh, ABA is for teaching, kids imitation or just great training or how to talk, but also she said he gets Monday through Friday. So that's good to know. So it's not that he's also not getting that. I think continuing to look at that data and figuring that out. And I've definitely, in my long history of being a behavior analyst, have worked, like Melissa said, in a variety of settings where some of my kids have been medicated. And I'm not a psychiatrist or any of those other things. But I have found, when working with those and collaborating with them, that sometimes medications can help, and they don't have to be forever, but sometimes it's almost like it brings you down to a point of like some of that learning the child is more available, where, it may be something where they're so anxious or so repetitive, rigid, where now there are some medications that are actually on book prescribed for some of those problem behaviors. The agitation associated with autism, I believe, is what some of the medication is related to. But it almost helps that child be more available for learning to learn those replacement and adaptive skills. And again, it doesn't have to be forever, and you want to definitely be highly monitored. And I think really working with the BCBA, having the BCBA share that data. So, let's say you're going in January. So getting those graphs from the past 3 to 6 months of data on aggression and anything else, and with information about what interventions have been tried, to share that. Because then if, like, let's say you do a trial of medication, you can then compare it directly to the pre-medication time of like, okay, now look, here's that line of where we started this, knowing that X medication maybe takes a couple weeks to get into system. Can we watch that? What's happening? Maybe not changing anything in that first month or two, because you don't want, is it the med or is it this new intervention? So really thinking about it in a very scientific way of, and then having the BCBA continue to update those graphs, continue to share those graphs with the pediatrician, even if it's allowed, having the BCBA collaborate with directly, or even attending those meetings with you to really give those that information to the prescriber, you know, because they may also be able to help. The BCBA and the ABA team can help with tracking side effects as well, because I know a lot of us are so worried about side effects of those types of medications, attending, you know, sleepiness or lethargy, or, you know, all those different things. So they can help you create data collection systems that are feasible for you as a parent, to also help track some of those things. Because I know sometimes we worry about the activation side of some of those things where it gets worse and you're like, nope, that's not what I wanted to see. So that's what I would do, really. And I think, honestly, you know, this has been so bizarre this past 9 months. I can't believe we're coming up on almost a year in the US of it. I mean, we're all like, I think, again, all of us are probably at like at least a 25% higher level of just baseline anxiety right now, and just like not being able to understand or control, and because it's just so crazy. Again, I'm not a psychiatrist or a psychologist, but you know, and even any kids, neurotypical or not, you know, it's just that level of just like their baseline level of just anxiety and sort of their. So then we were seeing behavioral ramifications in everyone. So I also worry, like, does someone need maybe something now just to help, even just in the pandemic while we're dealing with virtual learning without that level of structure and support? Because, you know, your child maybe was in a full day EI program before and ABA in the evenings, and now it's ABA during the day and there's nothing in the evenings, and it's just everything's different and it changes. And then sometimes people have to go on hold because they're sick and now they can't come in your home for 2 weeks because they, you know, and so then, you know, there's no right answer, but definitely use your data.
Thanks, Kathy. We have some more questions, but why don't we keep going and then we'll swing back to the next set. Okay.
Great. So yes, perfect. I love questions. Consequences are things that we put in place to reduce the probability of those challenging behaviors occurring again. In that case, you would think about something being a punisher. But we also think about interventions or consequences we put in place for appropriate behaviors to then increase the likelihood of appropriate behaviors occurring, so that then therefore there's less opportunities for the inappropriate behaviors to occur. Think about this as like even toileting accidents. It could be your maladaptive behavior. So you want to think about, how can I reinforce the heck out of appropriate toileting so that there's just less opportunities for accidents to happen. So same thing, how can I reinforce the heck out of appropriate breaks, you know, or asking for appropriate breaks, or using my words, or following directions, so that there's just less opportunities for aggression to occur. Sorry, I'm like graphing with my hands. So when we think about what are we doing after challenging behavior occurs, so really, again, using these with antecedent management, teaching procedures to teach those appropriate behaviors, your communication, functional like responses to get that immediate need met, as well as with lots and lots of reinforcement for appropriate behaviors. Excuse me. Consequences should be planned ahead of time. We want to make sure everyone's on the same page and that they're consistent. You think about, you want it to be very like obvious and clear to the child that every time they hit their brother, the same thing will be happening, because you don't want them testing it. A lot of times when I talk about consistent consequences, you think about a vending machine versus a slot machine. So a vending machine, I know when I put now it's like not a quarter. It's when I slide my credit card, and if the credit card works, there's some intermittent reinforcement there. But let's say, assuming my dollar bill works and my credit card works, and I push the button, 99.9% of the time, I'm going to get the Diet Coke. Again, there's always that time when it gets stuck. But then you think about a slot machine, and so that's consistent. So I know exactly what to expect from a slot, from from a vending machine. From a slot machine, you know, it's intermittent. So I keep going, and I might keep trying. When you think about, going back to the vending machine, if the vending machine doesn't work when I put my money in and it keeps my money, I'm not going to try again 3 more times. I'm switching to a new vending machine. I'm calling the person, the number on the thing, saying, give me my money back. I'm not like, oh, maybe it'll try again in 3 more times. When you think about then a slot machine, I put my money in or I hit the button and I keep going because it's intermittent. It's not consistent. So I'm willing to try. I'm willing to try $200 worth or whatever, depending on where in the night we are, right? So you think about like, how many times am I willing to hit that button to occasionally get something back from it? So you don't want to be a slot machine. You want to be a very consistent vending machine. So your kid knows exactly what's happening. And you want to follow through every time. So, thinking about, so if your son hits something or if they throw the iPad, then the iPad goes away for 10 minutes. Or if they spit out their food because they don't want to eat the peas, again, feeding is a whole other thing. But if it's something just, they represent the peas until they eat the bite of peas. Same thing with like when you think about sleeping, right? So if your kid comes out of the bedroom, good night, buddy, go back to bed, put him back to sleep. So very consistent so that there's no question about what's going to happen. Previewing them as rules. So, ahead of time saying like, if you throw your toys, you have to pick them up. I'm not helping. You have to do it before you can do anything else. If you hit your brother, the iPad is going to time out. The iPad's going away. Just, giving them the expectation of knowing what's going to happen. You can even make little visuals of like, a throwing iPad and like no iPad, things like that. Again, not a plug for reinforcement. Make sure you're doing lots of praise, lots of attention, lots of access to fun things when your child is appropriate. That's the best way to that's the best bang for your buck. So we really want to, provide, just make them be like, oh, this is what I should do because this is how I'm going to get what I want. So then thinking about other consequences, extinction. Some people will call this like planned ignoring or things like that. So when we stop reinforcing a challenging behavior, we are not reinforcing it. We're not giving escape when a child engages in paper math worksheet ripping. I have 20 more ready to go. I'll just give you the next one. Like there's no longer, that is not effective in getting out of your work. This can be tricky as far as it being how you address it, because it can escalate. But again, you'd want to do this with a behavior analyst for something that's like self-injury or something that's anything dangerous. But essentially, to do extinction, you would figure out why is the function of the behavior. You need to pair this with teaching appropriate replacement behaviors. So in the math worksheet example of if the child is continuing to rip up the math worksheet, make sure you're also working on I don't want to do this, or a break, or a help please response, because otherwise they're just going to keep ripping things or just do something else until you give them something appropriate to do. You want to reinforce those replacement behaviors of like, I need help, great, okay, let's help, or I need a break, okay, take a break. And then you're reinforcing those, and then you're no longer reinforcing those maladaptive behaviors. You're ignoring them. I know on ignoring. Ignoring is hard. Remembering you're ignoring the behavior, not the child. You're not like leaving your kid alone. You're not talking to them. You are neutral. And you can continue to direct the child what they're doing. Pick up your toys. Keep going, pick up your toys. You're not saying things like, don't do that, don't throw your toys, that hurts my feelings, you're gonna lose your toys, like none of that. And you're not like leaving the kid alone. That's not what I'm saying. You're ignoring the behavior and not the child. So you're putting the behavior on extinction, not the child. So that's extinction, and really you want to be making sure it's paired with Jenna, I see your question. Well, we can come back to that in a second. Sorry, I'm like randomly seeing comments pop up on my screen. I'm not sure, I'm probably not missing some of them. So really, I think the important thing is that you're teaching that appropriate behavior. Sometimes extinction, like full extinction, is not possible. The kind of thinking about like something like, especially if you think about like like disrobing, right? I can't, we're at the mall and Johnny's like, well, disrobing gets lots of attention. I can't ignore the disrobing if we're at the mall. I have to do something about it, right? So that might not be the best intervention to pick for something like disrobing, because it works at home, but if he takes off all his clothes at the mall, I can't ignore it and just keep telling him neutrally to put his clothes back on. The police would probably get called. So you want to think about what's also functional and that you can use across settings. And so something like hitting, again, too, I can't ignore hitting. I can move myself. I can move his brother if he's hitting his brother. But that's why something like self-injury or something like that, an extinction, you really want to be planful about that, because it may escalate. And oftentimes behavior analysts will talk about like what's called an extinction burst, where again, think about think about your vending machine again. When the first time it doesn't respond, essentially it's putting you on extinction, your behavior of putting your money in. So you might try it one more time. And then you get you maybe try, or maybe when it gets stuck, right? And then you try hitting it and you try pushing extra buttons. So you're engaging in more behavior. So it's what might be seen as an extinction burst. I'm engaging in more behaviors to try and get my Diet Coke. And then finally I give up and then I stop paying attention. I stop engaging with that vending machine. But that initial part of when I'm really frustrated and I'm shaking it or yelling at it, or it's that emotional response because it's not doing what it's supposed to be doing. That's what we might call an extinction burst. So extinction is tricky, and a lot of, I think really it's got to be very planful, and you really need to make sure that you're working on appropriate behaviors. So we can come back to hitting in a second. Then you've got timeout, which again, a lot of people use. I've seen it used incorrectly in daycares and schools and at homes and things like that. Really, it's only effective if if a challenging behavior gets access to something. So if I engage in hitting to get attention, or I engage in hitting to get tangibles, then a timeout can be effective. If I engage in hitting to get out of, for you to leave me alone, because I don't like the sound of your voice, or because I want to just be left alone, then timeout's not effective because I'm essentially getting what I want. You're leaving me alone. So I think also timeouts are really not going to be functional or effective for something like an automatically maintained behavior. So if I engage in hand flapping or hand wringing or something, me going into timeout is not going to impact that, because I'm not doing it for attention. I'm not doing it for access to tangibles. I'm doing it because I enjoy it. And so that would not be an appropriate intervention. And this is timeout in the sense of a very behavioral timeout. I know a lot of us will use timeout or a break, just time for a child to recoup themselves and get back to baseline. I wouldn't call that a timeout. That's something different. But in the sense of a traditional timeout, you are removing them, you're no longer giving them attention. Maybe they even have to watch other people getting attention. And then at that point, normal interaction should resume. So if I hit somebody, because this happens a lot, mommy's talking to the teacher and the kid comes up and hits mommy because they don't want mommy talking to the teacher, then the child maybe isn't put in timeout. Mommy keeps talking to the teacher, and then after timeout, the set duration is up, the child can come up, and then you may prompt an appropriate response of, mommy, can I talk to you? Or mommy, let's go, I don't want to wait anymore. Then it's then you should respond to that. Yeah, let's go. And then you go. There should be no residual or ongoing consequence of why did you do that? You shouldn't have hit me, blah, blah, blah. Just move on. So that might be a timeout from attention. Similarly, timeout from tangibles. So if we talked about and again, you want it to be the functional reinforcer. So, if I engage in hitting to get access to the iPad, so I hit my brother because he has the iPad and I want it, then you're not allowed to have access to that tangible item, and you may then that it goes into timeout and you can't have it. his brother could still have it, but you can't because you hit somebody, and you're not allowed to have the iPad. So there again should be, once that prescribed time has passed and the iPad would be available, assuming that you ask for it appropriately, or on the whatever schedule the iPad is allowed to be had on. But again, no like ongoing, you lost it for the rest of the day, blah, blah, blah. Unless that could be another consequence that you have. So those are like consequences. Really, the main thing about consequences is that you want it to be based on the function. So it can't be like arbitrary. The consequence should be, related to why that child is engaging in the problem behavior. Like I said, timeout, if you use a timeout for escape maintained behavior, it's not going to work. So again, if I'm ignoring you, or like I use some sort of like, let's say I use it, we've had kids like engage in, like you think about, a kid's engaging in problem behavior during work, and you don't get the right function and you think it's related to escape, but actually it's related to like attention. So then you're continuing to provide lots of attention and telling them to keep going and don't throw your pencil. And you think that they're trying to get out of their work, but really they just want your attention. You're giving them tons of attention, and you are then reinforcing whatever maladaptive behaviors they're engaging in, because you don't have the right function. So then you've sort of created a bigger problem. So really, when you think about any sort of consequences, you want to make sure you understand why like problem behavior is occurring.
Hey, Kathy.
Yeah.
Kind of connected to that, another question about a behavior where a child fakes injuries for attention and the caregiver cannot remove the attention because they need to check for an actual injury.
That is great. And so,
yeah,
I think that's really great. And so I think you got a couple things where you could go on there. And one thing that that's so tricky, is what we would call differential reinforcement. So kind of similar to the extinction, where maybe you can't, so you can't ignore disrobing in public, but you can minimize attention. So let's say, what you might do in that case is you would super neutral, either just gather, because you can't, like, you're not going to let your kid run around naked at the mall. So you would, have everything prepared, gather it up, help redress, but maintain like super neutral, no attention, or like minimal attention, no eye contact, no talking. If you have to direct, it's very short, to the point. And then once the child is appropriate, then you go back to like the super high praise, lots of attention, lots of appropriateness. So something like the faking an injury, because you do have to check to see. So there's that history of them, like they've gotten boo-boos in the past, they get lots of attention. So then they're like, I'm going to pretend I twisted my ankle or whatever. That's really tricky. What I would say is something to the effect of maybe having things like, let's see, I think really like when a child does engage in, or gets hurt, unless it's like a visible, like they've scraped themselves and you see it. But I think really like how providing lots of attention outside of that. And then when you are examining or checking for injuries and things like that, being more neutral and less attention. So that way you're still not ignoring them and you're still checking to see if they are hurt. But you're not like, oh my gosh, are you okay? Let me check. It's just like, okay, where does it hurt? Does this hurt? And then, potentially adding, again, this would like some sort of reinforcer for accurate reporting. So like if they're lying, they, again, and it's hard because we also don't know, and kids can have weird pain tolerances and either high, low, and you're like, oh, your arm is broken. It's been broken for 2 days. I didn't know that. So I think really though, what I would do is kind of tone all the attention down when you are examining for that, so that it's more of a neutral thing. And again, like you don't want to be brusque and mean and have poor bedside manner if a child is actually really hurt. But in the meantime too, then you'd also really want to be focusing on teaching the child how to other appropriate ways to get attention. If it's, telling a joke or teaching them how to ask for your attention, or like initiating conversations and things like that, so that then you can still attend to injuries potential or not, but that you are outside of that in the rest of the day, really focusing on just other ways for that child to get attention. So yeah. Is there any more questions, Melissa? Honestly, these last 2 slides, it's really just sort of like it's still is crazy. It's still not normal.
Still crazy. We do have one more question about dealing with interrupted sleep when a child wakes up in the middle of the night.
So like the child's interrupted sleep?
How to deal with interrupted sleep when a child wakes up in the middle of the night.
Got it. Okay. That's a whole other presentation one could probably do. Really quickly for sleep. What I would say is, and I've totally been guilty of this recently because our routines have been off, is I keep letting my kids fall asleep on the couch. I then carry them upstairs to their rooms. And then when they wake up early because of their sleep cycle. So the way your sleep cycles work is you wake up, sort of almost wake up a lot throughout the night. And so when we talk about like interrupted sleep, a lot of times it's because something's different, right? So a lot of kids, when you think about when you fall asleep with your child, which is okay, and I still do sometimes, but then you leave, something's different. So when the child wakes up again or gets to that almost waking point, if it's not the same, then they're more likely to like wake up completely. And that would lead to then that interrupted sleep of your child waking up at 1 in the morning, and then coming to find you and, either not being able to go back to sleep, or things like that. So really, I think the biggest antecedent management strategy for sleep is really making sure however they fall asleep is how they're going to sleep the whole night. Things like if you've got a white noise machine, making sure it's the kind that goes the whole night and it doesn't stop, because if that white noise is off, like when they get to that sort of, I'm not being very scientific about it, but when you kind of get to that almost awake point, if it's different, then you're more likely to wake up and be like, something's wrong. And which I'm sure is like a biological adaptation, if I were an anthropologist or something like that. So you think about when your kids, like if you fall asleep with them and they're doing really well, and then you sneak out of the room, if you're not there, and then they'll fall back asleep as soon as you're there. And so again, for sleep, then antecedent management best is setting that up so that it's the same. If it's that you don't fall asleep with them, which is hard, and that you are out of the room before they fully fall asleep, and that the white noise is there, or that the blankets there or whatever. For as far as interrupted sleep, I think really thinking about if they do wake up. I definitely had kids that I've worked with in the past where like once they're up, and then it can be hard. They may start to engage in problem behavior because they want the iPad, and you're like, it's 1 a.m. and no. And I think that's really hard, because at that point too, as parents and as adults, like unless you happen to have like awake overnight, where a lot of like residential schools would have like an awake overnight, you are not awake. You are not in your most neutral state of mind, for sure. Anything depending on what your child level of understanding might be, to have those discussions in the morning, or at night before bed. Remember, if you stay in bed all night, or if you stay in your room, you can even set up contingencies as far as you can pick your special breakfast. Like you have special breakfasts that maybe is only available if you stay the night in your room. And maybe at this point, maybe it's just like you stay in your room and there's like a busy box of stuff, not electronics, but like, maybe like books that your child might like, or things like that. I'm not at all necessarily condoning that you lock your child in their room. Again, I think there's a balance there of working with someone that has like a specialty and like looking at the data there on like how often is it happening, things like that. But I definitely have working on some sort of contingencies, or if the child gets up, and you just redirect them. I think the biggest thing is being super neutral. time to go back to bed, and, helping them get back to sleep. If they engage in problem behavior when they are awake, I think that can be really hard, because as parents going through a pandemic, it's really hard we need our sleep, whatever we're getting. So I think it's a great question, and I think if you have a behavioral analyst that you're working with, I think is something to discuss, or looking at even sleep specialist.
There's a follow-up to that, Kathy, and you may have addressed it. Would you say sleep is behavior-based then, and not always routine-based?
I think there's a piece to it. So there's a behavior analyst up in Massachusetts. His name is Dr. Greg Hanley, and he actually on his website has like a sleep assessment tool. There's actually a lot of behavioral studies on sleep. A lot of it is there's definitely a behavioral, like a conditioning piece to that, as far as like being able to fall asleep, dependencies on like having mom there, having mom or dad touching the child. Like kids won't fall asleep unless you're actually like touching them or having certain things in place. And so there, in that case, there is a behavioral component to it for sure, where there are interventions you can put in place, like, and they look at like latency to falling asleep, night wakings, what happens during those, and having those interventions in place for sure. Data collection can be your friend, like things as far as like, and other antecedents, having those routines, having those calming routines, making sure your kid, your child is getting enough exercise and movement and exposure to like natural, vitamin D and all of the things that we're also probably not getting as much of now, especially that it's like 30 degrees outside, but that, minimizing screen time before bed, all of those things that, probably I'm, as a parent right now, not doing very good at, because we fall asleep watching TV on a regular basis. But all those things to help set the stage for better sleep. But there definitely are behavioral sleep interventions that can be very effective.
Thank you. And we have another question. Child tells other sibling that they can't sing, play piano, etc. at all because it bothers him. Suggested that he use headphones, but he refuses. Says he should not have to change his behavior. The others should, since he sees it as offending him. This isn't fair to the others. How do you resolve this?
That is such a great question. And I can imagine how, if then that continues, then you get into some potentially like higher level problem behaviors. A lot of behavior analysts now, we talk a lot about the sort of a fifth function of what we call control. And so in this case, it seems like that, where this particular child wants to control his or her environment, and the behaviors of others. And there is a potential that is actually aversive to the child. Those things like sounds or music, or I've had kids that are upset with dogs barking or different sounds, vacuums can be really rough. But again, like in wanting to control those things. And so there could be an automatic sort of sensory component to that, as far as that being an actual aversive sound. In either way, we would consider using toleration training. And so something for like the child in this case, where, especially if they are able to tell you like and verbalize all those things, really, I think, clearly, like you indicated, for your family, that's not possible, right? Your child is that particular child is in a family group, and there's things that need to happen, and sometimes you have to wear headphones and sometimes you don't. So I think what we do in those cases are different types of interventions to work on, like giving up control, or sort of tolerating access, delayed or denied access to controlling the situation, where it's like, if the child asks to not, Susie, stop playing the piano, and Susie stops, then maybe next time it's Susie, stop playing the piano, and Susie's like, in a minute, and then they have to wait. And so I think it's sort of, again, teaching like what we need, because the world is not going to, be manipulatable for him, because he's going to go to school. He's going to have to go to music class. He's going to be at the grocery store and hear me. What is he? You can't tell the people at the grocery store to turn off the music that you don't like. So really like tolerating that. And that's a very behavioral, there's a lot of procedures that we can implement again. And I didn't mean to say, it's not like difficult. You just really want to monitor your data, but there are definitely what we call interventions for delay and denial training, specifically related to like control. And again, I think, like you said, you suggested headphones. And if it's something simple as like, okay, today I wear the headphones, tomorrow, we don't do this, or, having like we spin the wheel type thing. And so building in some way for that child to have some control over the situation, but also not like controlling your life where it's turning into that child is ruling the house and interfering with his siblings' ability to enjoy their lives or have friends over or all those things, because that also is not fair and will result in a lot of difficulties and animosity. So I think it's a great question. There's a lot of things we can do behaviorally that I couldn't necessarily get into that, but definitely is something that is addressable.
That's it for questions for right now. If you wanted to wrap up here.
Yeah, really the last thing was just a couple of slides. I mean, again, I started these like when we went over this in May, and it's still the same. Again, as parents, just giving yourself a break, being flexible. I'm going to be honest, hopefully there's no teachers here yesterday. My kids, I didn't have someone help during the day, and they were like, well, I'm not feeling well. I'm like, I think you're okay, but I need to get my own stuff done. So go ahead and just take a break and build a pillow for it. Like, whatever. They didn't go to school yesterday. So being flexible, setting reasonable expectations, lots of antecedent management. So, first thens, this is what I'm expecting you to do. I locked the door so that they can't come in. Not sure if you can hear them. Just know that you're doing your best. Ask for help. And advocating. And I think, again, really a lot of this has brought to light sort of many of the inequities that were already, I think, visible, and now are even more so with many of the, just our special ed kids and kind of what's happening and what's happening there. So advocating for yourself, working with, if you can find someone to help advocate for yourself and for your child, because I definitely think this has not been ideal for the kids that we serve and that you guys, are with daily. And it's been really hard and really eye-opening. So it's something I really want to work on personally and as a professional. So, yeah. And on a sad note there, sorry. I'm almost done.
That is a lot of information, Kathy. Thank you so much.
Of course. Let me stop sharing.
Anybody else with any other questions? I don't see anything in the chat. You have your contact info to share, I hope, on the...
Yes, sorry. There was someone that needed someone in here right now. The 4-year-old needed something.
That's okay. No
I don't know what he needed. Here is my contact. This is like my company. You need a piece of paper. Okay. So yes, verbalbeginnings.com. Again, they can find me if you have any questions. Like I said, and actually right now our everyone from our center is in home too. We're all in home again, but we have feeding therapy. We have diagnostics. We have lots of opportunities there. So, yay. So it was wonderful. Thank you for all the great questions.
Kathy, thank you so much. I want to thank everybody for joining us today. And I'm glad that Kathy mentioned about self-care. I know we have a mom and dad's night coming up in December. We have a monthly general support meeting, our Latino parent support meeting, Asperger's group. And I know that Pathfinders for Autism also has some wonderful resources. And it is an awful lot on everybody. So hang in there. We hope the end is coming with vaccines, and that everybody will be back to a more normal routine sooner rather than later. So Kathy, thank you again. I wish everybody a very happy holiday.
Yeah, thank you.
Thank you.
Okay.